Hello, my name is Charmaline Chantella Raminto, and I am going to present my case study media project number one. A little bit of background about me. I am an ophthalmic technician. I work with a retina specialist, and my case study was based on like most patients that we see. So, um, all of the symptoms and signs, and also the things I know, I put it in together in this presentation, but it's not like a actual patient. Okay, so a patient that's 66-year old, he's male, reports sudden onset of floaters and followed by loss of vision in the right eye starting about 2 days ago. So patient is referred by optometrist for retinal consult. So let's see here. So patient's past medical history. So patient is diabetic. They have diabetes mellitus type 2. They were diagnosed 20 years ago and insulin dependent. Patient is taking Lantus and metformin. So their last blood sugar is 245 and last hemoglobin A1C based on their last lab is 12. So patient also has kidney disease and currently on kidney dialysis, which started 5 years ago. Patient also states he is taking water pill for swelling, and they were recently at the hospital 1 week ago due to pulmonary edema. And based on the review of systems, they have shortness of breath, frequent urination, numbness, and tingling on legs. So B scan was ordered by the doctor and it revealed dense vitreous hemorrhage. So vitreous hemorrhage can be diagnosed through different imaging tests. It can also be seen in fundus photo, but since there's no view and the doctor wanted to check the back of the retina if it's attached, because sometimes with diabetes, diabetic have tractional retinal detachment, but the B scan showed that they only have dense vitreous hemorrhage. So the doctor's primary diagnosis is vitreous hemorrhage in the right eye, secondary to active proliferative diabetic retinopathy, while the left eye has non-proliferative diabetic retinopathy with diabetic macular edema. So the patient is diabetic. They have type 2. So type 2 is characterized by when the body can't use insulin. So insulin is a hormone that produced by beta cells in the pancreas. The role it plays is to control sugar in the blood. So when there's high blood sugar and the diabetes is not well controlled, the kidneys, the heart, the blood vessels, eyes, feet, nerves are affected, which is the case for this patient. So diabetes and the eye. So when there's an increase in blood sugar, tiny blood vessels in the eye get blocked in the retina. So it leads to abnormal growth of new blood vessels. And it's called neovascularization. Neo means new, vascular, of course, blood vessels. So neovascularization is a characteristic of proliferative diabetic retinopathy. And the doctors that I work with, they usually describe it to the patient like a ticking bomb when they see a neovascularization because it can bleed or leak easily, which was the case for this patient, which lead to the vitreous hemorrhage, and that is characterized by floaters and sudden loss of vision. So the diabetes and the nerve. This patient reported numbness and tingling in their legs. So when blood vessels get damaged, their nerves also get damaged. So this is called diabetic neuropathy. So when the blood is not getting into the nerve, it will stop nutrients that are needed. So the nerve job is to carry chemical messages to and from the brain. And when it's damaged, of course, it's unable to play its role. So it won't be able to send messages properly, causing change in sensation and feeling, which includes numbness and tingling, which again was the case for this patient. So the diabetes and the lungs. So patient was hospitalized a week ago due to pulmonary edema, and based on the referral note, the patient is um, diagnosed of diabetic cardiomyopathy. So this is when the heart can circulate blood that leads to accumulation of fluid in the lungs as well as the legs. So that's why probably they're also taking water pill. So if the heart can't pump, the veins get backed up with blood, so pressure increases and then fluid is pushed through the lungs, causing pulmonary edema. So again, if you have any questions, you can put a comment on this video. Also, I would like to share about what would a retina doctor do for the vitreous hemorrhage. We usually do eye injections in the office to help with the bleeding. But if we do the injections and the patient come back for follow up and it's still bleeding, we would do a surgery to help clear it up called vitrectomy. Again, thank you. Bye.